So do lawmakers in Washington need to chill out? Joining us to give us both sides of the issue are Democratic Congressman Joe Sestak of Pennsylvania and Republican Congressman Dan Burton of Indiana. Welcome to both of you today, gentlemen. You know, this is a really big problem. We're looking at the economy, and of course the president echoing that if health care goes on in its continuing form, it will derail the economy. But then you have the CBO gentleman coming out with the news that the current plan that they're proposed in terms of legislation would only further derail the economy. Congressman Burton, what do you say about this?
Well, it's not just CBO. The president's chief economic advisor said if we raise business taxes like this plan would provide for, we'd lose as many as 4.7 million jobs in America. Because we're raising those business taxes. In addition to that, the total tax increase over a decade would be about $800 billion in new taxes, and it's going to affect the Medicare Advantage for seniors, and ultimately will cause rationing of health care.
Congressman Sestak.
You know, it's interesting. CBO just came out with a new study on Friday that actually said that the proposal in the House is deficit budget neutral. In fact, if you noticed what that gentleman said from CBO was our bill does not slow down very much the growth of health care, and that's true for this first year. But look, doing nothing is not an option. We've done that, let's say, over the last 8 years, as here in Pennsylvania, health premiums have gone up 85%, and 7 million Americans have lost their health insurance. So what this budget does, in a budget-neutral approach, is it says bring in the uninsured, because if they are covered, the insured will be paying less. We pay per family right now $1,100 if you're insured for the uninsured, because the cost is passed on to us. Second, what it says is a public health care plan option begins the competition that we only have 70% of all health care plans in Pennsylvania in 2 companies. We need to get the competition to lower costs. This is a very good plan.
Well, let me tell you what the public, we're getting, this is from Facebook. Bobby Bush writes into me and he says, listen, Kelly, the fix needs to happen within the system, not reinventing the wheel. Now, we have the Republicans offering their plan. We have the Democrats offering their plan. So how do you accomplish what Bobby, the average American, wants to accomplish? And that is not reinventing the wheel, but dealing with the system that we have and making it work for everybody. Congressman Burton.
Yeah, I think that's something that can be done, and we have made some suggestions that we think would really improve the health care system. But if you look at a map or a plan of the Democrats' program, it looks like a spaghetti bowl. You can't follow what you have to go through from one point to another point to get help. And in addition to that, you know, we haven't seen that plan. That plan is going to have a total of about 1,100 pages, and nobody in Congress has yet read it. And we're supposed to vote on this within 2 weeks. And I think the president wants us to vote on it before we go home because they know there's such growing opposition among the people of this country.
Gentlemen, let me get this in real quickly because we're running out of time. Congressman Sestak, what's the problem going back to the table, going back to the drawing board? Why does it have to be done before the summer recess?
Well, as you know, over the last 8 years, it's not what it looks like. It's what are the results. When Congress was controlled by the Republicans, as you know, we lost 7 million Americans uninsured. They didn't take any action. Look, if we don't act quickly here, you're then into next year's political elections, and people tend not to be as courageous, and that's a shame. However, this does permit every American. It doesn't reinvent anything. What it says is stay in your health care plan with your doctor if you want to. All it does is says, you know, those 47 million Americans that you and your family pay $1,100 more for on your private health care plans because they go in an emergency room and you pay for it anyway, it says bring them in. Let them choose one of the plans. We subsidize the less poor because you pay for it anyway. It's just being honest, accountable government
Congressman Burton,
that for the last 8 years hasn't been done.
And Congressman Burton, I see you itching to get one word in, but
I'd just like to say in closing, Kelly, that if you think government's done such a good job of running everything in our country, just think of what it's going to be like if we have the federal government running health care. It's going to cost more, it's going to be less efficient, and it's going to end up rationing health care, socialized medicine.
Well, you know what, gentlemen, I hope that both sides of the aisle can come together and get something together, because obviously you both agree that something has to be done. The president agrees that something has to be done, and he's vowing to get it done. The American public is saying, get it done, but how about a plan that makes it look like what you guys are getting there on Capitol Hill? We thank you very much, Congressman Dan Burton and Congressman Joe
Thanks,
Sestak.
Kelly. Thanks,
Have a great
Dan. Good to
afternoon.
be on
Kelly.
with you.
Okay.